Good evening, everyone. This is Dr. Amrendra, and I am from Aesthetics Dental Experts, which is located in Amrapali Zodiac Market, Sector 120, Noida. So, it's a dental education video in which I am going to tell there are some misconceptions are there among the dentists also and among the common peoples also who used to have some dental decay or any dental issues. So today my topic is very interesting and it tells you about whether sugar is good or bad for teeth. I'm saying it again, whether sugar is good or bad for teeth. So I'm trying to say, suppose you are eating any food which contains sugar, suppose you are taking any tea, coffee, or any cake, pastry, or ice cream, the amount of sugar and the amount of frequency that matters a lot. I'm trying to say it is not the sugar which is the main culprit, it is the time, duration, and the frequency which the sugar intake is there in your mouth that is going to lead the tooth decay. So again, try to understand in simple words that suppose you are taking any hot coffee or cold coffee or any cake or pastry in a duration of 5 minutes, okay, that amount of sugar is going to accumulate in your teeth for shorter time. And suppose same amount of sugar, suppose in same amount of sugar, I'm trying to say that the same thing you're taking any beverages or any food which contains sugar in a longer duration of time, suppose you are watching a TV or you are doing something or taking a coffee sip by sip, the same amount of sugar in 15 to 20 minutes instead of 5 minutes. So here you see that the same amount of sugar will lead to more teeth decay, because it is like that when the amount of sugar is going to interact with the plaque or tartar which is already present in your teeth, that is going to release some acids and that acid leads to erosion of your healthy tooth. So make it a point that if you have more like tartar or plaque in your teeth, then there is more amount of erosion which is done by sugar. Okay, so you need to regularly visit your dental hygienist or any dentist which is going to clean your teeth, so there is less amount of tartar or plaque present on your tooth. If you are sugar friendly person, like you used to eat a lot of sugar, then it's always essential that there is less amount of plaque and tartar. That is another point, one point. Okay, now I'm telling you something about the frequency. Like suppose you are taking sugar intake in a regular frequency of 1 hour, 2 hour, or 3 hour, then there is more chance of tooth decay also there. But if you are taking a regular frequency is 6 hours or 12 hours, there is a long gap, then there is less chances. And whenever you are taking any food that contains sugar, make sure that you uses some mouthwashes or uses at least some water, or at least you can brush your tooth immediately. So the amount of sugar consumption could be more, but the amount of sugar stays on your tooth has to be, in any condition, has to be very less. So in that case you are not going to get any cavities. And I would like to say something about kids also. Suppose try to make it a good habit that if your kid is eating a lot of chocolates or sugar or anything, then try make him good habit that he has to brush after that. Make him think like if you're going to eat chocolate, then you need to brush your teeth regularly. In that sense, you will get less amount of cavities. Other thing is also there. I have seen in many young kids, like maybe 6 months, 1 year, 2 year, they have some nursing bottle caries. Nursing bottle is like a caries which is very much recurrent and it's very tough to treat. So I would like to say, suppose their kids are drinking any milk substance which contains a lot of sugar through a bottle, then I will encourage mothers to use some water, okay, in that particular bottle or in small glass, so that the amount of sugar which is present in your teeth can be washed clearly. So give that amount of water to your kids, so there is no chance of sugar accumulation in your teeth. So in that sense, try to understand that if sugar is there, okay, and it's going to, suppose this is, I'm trying to make it simple, very simple. You can see this stuff now, it is very clear to you, yeah, everybody can see. So you can see all these cavities are there. Here is a cavity, and in the top portion also some cavities are there. So why it is there? So this is your tooth surface, and understand this is your tooth surface, and the sugar is going to stick on this tooth surface, and there is amount of plaque or tartar which is present on all these tooth surfaces. So this is going to interact with that sugar, and that sugar is going to release some acids which leads to all these cavities. Okay, so again the same stuff is coming, that if it stays for more time, if the duration is more, the frequency is more, and other things are more, then the amount of decay is more. So it's not the sugar which is the main culprit, it is the amount, duration or frequency which the sugar intake is there. So the other substitute, you can use some xylitol, like there is some sugar less chewing gums are there to decrease the amount, or you can use some stevia labs sugar products are also there, that is also good for your teeth and overall appearance. So this is about the sugar misconception stuff. And if you like the video, and if you like to see more amount of these videos, these type of videos, then you can subscribe or like this our channel, and let me know. You can comment also, suppose if you have any issues, dental issues, like any root canaling question, any capping or any implant or any other, you can just let us know about that. I'll try to make a video for that, and I will try to encourage as information as I have that has to be given to you. So you can just like, comment or share this video, and you can share to your friends or colleagues who have the misconception about the sugar intake and any other dental treatment. So thanks for watching my video, and good night to you. Thank you.